Hi everyone, Howard Gearhauser here alongside my dad, Dr. G. In today's video, we have another episode related to the coronavirus, and there's some new reports finding that the darker the skin you have, the more susceptible you are to getting a severe case of COVID-19 or SARS-CoV-2. So this is some new reports, and the mainstream media has their theory as to why that's going on, and we kind of have a theory based off a lot of the things that we've talked about on this channel as to why that might be the case and how, your immune system might be weakened if you have darker skin in today's environment. So we wanted to talk about our theory, what the mainstream's talking about, and that way you have both perspectives and you can make up your own mind as to what to do. So Dad, can you just elaborate a little bit more on what was shown in these reports?
Yeah, so there's been some reports out, several of them now. First one that I saw was from the United Kingdom, where they're looking at the people that became critically ill, in other words, had to go into the hospital and into the ICU, and the percentages. So the percentages in the United Kingdom of critically ill people was that 30% of the patients were had dark skin, were of African or equatorial origin with a darker skin. And the percent of the population of that group is only 13%. So it's kind of more than double the representation you would expect based on how many people in the population have that dark skin, 13%, and then of the patients that are in the ICU, it's 30% are Black. So that, lights up some light bulbs. And then in the United States, we saw the same thing. So in Michigan, 40% of the critically ill were Black or dark skinned, and 14% of the population. So again, it's kind of a similar thing, only even more pronounced. And then Chicago, report very similar. Even though Chicago has 30% African American, their percentage of severe COVID-19 cases was 70%. So a big marker here. And it doesn't surprise me. I've practiced medicine for over 37 years. And my dark-skinned patients, I always had to work harder with them as far as what I say is the issue here. Now, the media, as you said, says, well, it's because they have a lower socioeconomic class. They have jobs that maybe don't allow them to work from home. They can't social distance as well because they're maybe in a more crowded living environment. So these things, and those could play a role, it's possible. But from my experience of treating patients for so many years, there's a reason for the darker skin. So the darker skin has more melanin. So melanin is an important molecule. It absorbs light. So it absorbs the light from the sun. And if you notice, the darker skinned people tend to have ancestors or still are living near the equator. So the closer you get to the equator, some of the darkest skinned people live at high elevation right on the equator. So that intense ultraviolet light that's in the sun close to the equator, you're protected from that, from an overexposure by having the melanin. The melanin is kind of like an umbrella, but it's more than an umbrella. New research shows that melanin actually might be a source of creating energy for the cell. This was proposed by an ophthalmologist in Mexico who noticed that if you're looking in the retina and you see the blood vessels in the retina, so the retina are really brain cells, which have the highest energy requirement in the body, brain cells, neurons. And so he's looking in the retina, and he noticed that the retinal blood vessels were very sparse. That you would think that something that needs so much energy would have way more blood flow. And what was hypothesized, one of the places where we have a huge amount of melanin is in the retina. It's called the retinal epithelial pigmented cells, the pigmented epithelium of the retina. And it's theorized that the reason there's such a lack of blood vessels is because they're not needed, because the melanin is there to add the extra energy. But to get back to my patients, if I had patients with diabetes, hypertension, heart disease, or any condition, I encourage them to go outside. Like that was my #1 recommendation, because here in Arizona, okay, doesn't matter what color you are, if you're indoors all the time, you're going to be susceptible to COVID-19 or heart disease or high blood pressure or diabetes. Now, the other thing is the conditions that are higher in prevalence in darker skinned people, like diabetes, like high blood pressure, like history of heart disease, those things are more prevalent too. And so that's, again, what the mainstream doctors blame it on. They don't think about melanin. They don't think about sun exposure. So my biggest recommendation for my patients, especially if they're Black, they need to double their time in the sun. So does any doctor tell their patients that the darker your skin is, the more time you have to be in the sun? Because the melanin is like an umbrella, and we critically need the sun for our health. So if you have an internal umbrella, then it just means you have to have more sun. So I've even told patients that we have some snowbird patients here in Arizona that, living at that high latitude, if it's shooting yourself in the foot if you have diabetes or you have hypertension, because it's really difficult in the winter to get enough sun. And then our modern culture where we work indoors, we're wearing sunglasses. I see dark-skinned people on hikes here in Arizona decked out like they're, a lily white, fair-skinned person, with all sunscreens and sun blockers and all this. The Black person doesn't need those devices. It doesn't need sunscreen. I don't need sunscreen. I'm kind of medium. I'm pretty brown, but I'm not really dark. But the darker you are, the more you have to embrace the sun, and that's just for your health. There's really not a way around it.
Yeah, and as you mentioned, it's not just COVID-19. We see this across the board with your patients and our health coaching clients. The darker your skin, especially if you live at a northern latitude, you're a lot more susceptible to all of the various chronic diseases, the modern diseases, and then viruses and infections apparently as well. So you have to really start leveraging the power of the sun. You need to if you have darker skin, because that's where your ancestors are from. You have so much programming that's been dialed in, from living close to the equator. This isn't by chance, versus someone who lives, who's very fair skinned, whose ancestors are from Ireland. They don't need very much sun. That's why they have such low melanin in their skin. So you have to take that into consideration. So the lighter skinned person is going to fare much better in this indoor environment because they didn't need a whole lot of sun in the first place from where their ancestors are from. So you have to think about that. You have to double down. I'm half Hispanic. My mom's from El Salvador, so I have to get even more sun than my dad does. So these are things you have to take into consideration and be smart about it. Anything you want to add to that?
No, I think this is important, even though this is a theory just based on logic, and there's a lot of evidence for it. This is not something your doctor's going to tell you. At least I've never heard any of my patients say, "Oh yeah, my cardiologist or my endocrinologist already told me that I need to be out in the sun more. It's almost like medicine encourages everyone to stay out of the sun, for everyone to wear sunglasses, for everyone to wear sunscreen. So really, those are things that you should never do, in my opinion, unless, sunscreen, the thing about sunscreens is they absorb into your skin. They have toxic chemicals that not only probably will kill us, but kill coral reefs. And, they're just a disaster waiting to happen. But I can see covering up. So once you've had too much sun, then you get out of the sun, cover up, go into the shade, get your umbrella, or whatever you need to do. Obviously, you can overdo the sun, especially if you're fair skinned, but it's more difficult for darker skinned people to overdo the sun. And I would say in my practice, it was 99% of the time the sun was underdone for almost everybody, but particularly the darker skinned people. And even the ones that worked outdoors, like a construction worker or a landscaper or something like that, they bundled up, because the bogus thing about cover up, no amount of sun is safe. That's what the American Academy of Dermatologists says on their website. No amount of sun is safe. And the ophthalmologists tell us the same thing, that no amount of UV light is safe, even though humans have been naked under UV light for millions of years. And we never needed sunglasses up until, 60 years ago.
Right. A lot of these modern ways of blocking out the sun are relatively new in comparison to how long we've been living in the sun without all this protective equipment. So something to consider there too. Well, I think that's it for this one. Thanks for tuning in. We'll see you guys on the next one. Thanks, Dad.